Okay. Hi, my name is Marietta Sangari, and I'm doing my video assessment 1 on nursing 210, and I would like to scan the room now. Scan the room, please. Okay. Okay. Thank you for scanning the room. Like I said, I'm doing my video assessment 1 in nursing assessment class 210, and I'd like to introduce to you Christopher. Thank you, Christopher, for letting me do my assessment on you. Thank you. Christopher is 19 years old, so he's above 18 years. So Christopher, I'm going to start by inspecting your hands and feet. I'm just going to look at your hands and feet, make sure that they're the color. I'm looking. Can you stretch out your arms for me, please? I'm looking at your hands. So I see symmetry, and I see the colors brown, and the hair on your hands evenly distributed. I don't see any discolorations. Your skin is intact. And may I see your legs, please? Do you mind? Okay, just check your legs. I see legs. I see the skin is evenly distributed, hair is evenly distributed, brown. I see no edema, and I don't see any nodules. Skin is intact. I'm gonna just touch and just feel your skin. The skin is warm to touch. And down here, warm to touch. Yes. So I just did my inspection and then palpation on the skin. I will also like to do the skin toggle here on your hand. Okay, skin toggle is normal. I don't see any signs of dehydration. I'm gonna take a look at your nails. Your nails are pink, and I see no clubbing. Well grown, nice and clean. Look at the other ones. Well grown, nice and clean, and no skin tuggles. Good here. Yep. All right. Legs. Skin toggle, nice and good. Nice, moist. Okay. Thank you so much. So at this time, I'm going to inspect your face, your head, and everything on your neck. I'm looking at your face here. I see eyes are symmetry, and nose at the center of the face where it should be. Look at your lips, they're moist, pink. And I'm now going to take a look at your head. I see that your hair is evenly distributed. It's black. I see the back of your neck. I don't see any nodules and no skin breakdown. The color is brown. It looks nice. So at this point, I'm going to palpate your head, just to be sure that you don't have any lesions or scaly, or have you had any problems with dandruff, Christopher? No? Okay. Can you talk loud, please? So now I'm going to palpate your head. Have you had any problems with any lesions on your head? Or, no. Okay. I see that your hair is evenly distributed. I don't see any dandruffs, and I don't see any lesions. No scaly scalp. Nice looking. Okay. So at this time, I'm going to just inspect your eyebrows. Thick eyebrows with symmetry. And your eyes are symmetric, and your ears are symmetric, and your nose. So now I'm going to wear my gloves because I'm going to be touching you with the pads of my fingers. Okay? So I'm going to put on my gloves. Wait a minute. Thank you for being so patient.
No problem.
All right. Gonna palpate your face. I'm gonna start with, you let me know if you have any tenderness. Okay, there should be no tenderness, but just let me know if you have any tenderness. I'm palpating your face. And your eyes, your eyeballs are firm. Your lacrima, have any pain here?
No.
Okay, thank you. How about your nose? Any pain? Okay, I'm gonna look into your eyes. I'm gonna use my otoscope. I'm going to check for your eye reflexes. Okay, reflexes are good. Okay. I'm going to try to close your eyes and see if you can open them. Okay? See if you can open that eyes when I'm pushing it down.
No.
Okay, all right. Thank you. So I'm going to check your nose. All right? Anything. Your nostrils are moist. You don't see any, the color's good. You don't see any swelling. Okay. And next I'm gonna take a look at your ears. Okay, I see it looks moist and clear. There's no signs of infection there. Okay, I'm going to look at the other side. Both symmetric from the other side, and it's clear. No signs of infection. I ask you to open your mouth, please. Open wide. Say ah. Look at your, can you lift your tongue out? Your tongue looks pink, moist, and the mucosa is moist. So, Christopher, I'm gonna take a look at your gums and your teeth and all of that. Okay, so I'll be sticking a thing in your mouth. I'm going to ask you to open your mouth again, please. Open my, So I'm going to just lift your tongue for me. Okay. Your, I think these are the center. Okay. And your gums. I'm looking at your gums. I don't see any receding gums. They look healthy. I'm going to look at the bottom too. They look healthy. And your teeth look good and clean. Very good. Looks moist and pink. At this point, I'm going to use my tuning fork to do the test, the smelling, not the smelling test, but the what's the test now? I'm gonna do your hearing test as well as your, what is that test? Vibrating. Okay, this is the tuning fork and I'm gonna use it to tell me when it stops.
Yeah.
Stopping now?
Yes.
Okay. I'm gonna put this by your ears again. Christopher, I'm going to do my next test will be the Weber test and the Rayner test. So I'm going to use my tuning fork and I'm going to ask you to tell me when the vibration stops, okay?
All right.
Okay. Tell me when.
Now.
Yeah, okay, thank you. That was the Weber test. So now I'm going to use the same thing to do the Rayner test, okay? Behind your ears. Tell me when.
Now.
Okay. Go to the other side. Tell me when.
Now.
Okay, thank you. So, I believe that I need to check your feet to see whether you have any edema. Let me put this one away quick. All right, I don't see any edema, and can you push that down for me while I pull up? Okay, thank you. Good muscles, good liquids muscles. Thank you. So I am going to do next my assessment on your head. Can you keep your head straight for me? Okay, and can you go side to side? Can you move your head from side to side? I'm just checking your neck muscles. Okay, and up and down. Up and down. Okay, down. All right. So while we're on the head, thank you. And try to put your ear to the shoulder and tell me if you have any pain. No, without moving your shoulder. Okay. Is there any pain? All right. It's a little stretch. Can you do the other side, please? All right. Thank you. All right. I am going to check your neck now. Inspect your neck and auscultate your carotid artery as well as your trach. Can you sit up straight for me? I'm going to check your neck. I see that these are your mandibular muscles. Can you open your mouth and close for me? Okay. I see symmetry. Okay, again. Okay, thank you. And lift your neck a little bit. Can you swallow for me? Try to swallow. Okay. All right, good. One more time. Good. Okay. At this point, I'm going to listen to your carotid artery as well as your trach. I'm going to use the bell point just to listen. I'm listening to see whether there's any bruit. There should not be any bruit sound. I'm listening to your trach. Okay. Excuse me, I don't hear any bruits. Thank you for that. My next thing to do will be to, let's see. So I'm going to now inspect the conjunctivitis to see if you have any conjunctivitis. I'm going to wear my gloves again.
All right.
I'm going to wear another pair of gloves. I'm gonna be palpating your eyelids and looking just to be sure that, okay, open. It's pink. I don't see any signs of conjunctivitis. It's pink and has little white noodles, which seems normal. And while we're doing the eye, I'm going to, I think I did your eye reflex, but I'm going to do it again. Okay, I don't see any redness. Can you open that for me? I don't see any redness and they're symmetric. So now I'm going to check your vision. I want you to keep your head straight, but tell me if you see this. I'm doing your peripheral vision. Straight, please. Okay. Don't just follow this with your eyes without moving. All right. Can you see this?
Yes.
Can you see that?
Yes.
Do you see that?
Yes.
Can you see the object?
Yes.
Okay. Can you see this object here?
Yes.
Follow this.
Yes. Yes.
Can you see the object now?
No.
Okay. So I'm just going to talk to you about the Snelling test. The Snelling test is a distant reading test, the cover test, okay? I want you to put one hand on one eye there, okay? And can you tell me if you see this?
Yes, sir.
Okay. Do the on the other side, cover your other hand. Tell me if you can see this.
Yes, ma'am.
Okay, thank you. So now I want you to, I'm going to do the smelling test on your nose. You're gonna close one of your nostrils. Oh, before you do that, I'm gonna look into your nostril. I'm looking for the, let's see, you see it's moist. And it's red. The nostrils are evenly distributed. I don't see any occlusion. Okay, thank you. So now I want you to close one nostril, and I want you to close your eyes, and I'm going to ask you what you smell. Okay? Okay, close your eyes. Tell me what you smell.
Apple juice.
Okay. I'm gonna. Can you change? Close that other one and keep closing your eyes. Tell me what you smell.
Vinegar.
What is it?
Vinegar.
Okay, thank you. Okay, so I think that I'm going to check your let's see, your feet again. I didn't do the to see whether you have varicose vein. Even though you're young, I like to see if you have any varicose veins. And I don't see it. And I don't see any edema. No varicose vein, no veins sticking out. It's all evenly distributed. Thank you. Something in your mouth. So I'm going to ask you to open your mouth for me one more time. I'm going to check your frenulum and your uvula. Open your mouth for me. I see your uvula in the center. Okay. And it's moist and right in the center. And your frenulum, can you lift your tongue for me? Frenulum is right in the middle of the tongue and it's moist. And thank you. Okay. I see no receding gums. I see they're pink. And your uvula is right there. Okay. Thank you very much. Thank you. Now we will do the facial test, and I'll do the whisper test just to be sure. Did you smile for me before? Can you smile again? Can you frown? Can you blow out your cheeks for me? Let me see. Blow out your cheeks. Okay? Any pain while you're doing that? Okay, I'm going to do the whisper test and you tell me exactly what I whispered to you, okay?
The red board.
Okay, good. I'll do it on the other ear.
Number 10.
Thank you very much. Okay, thank you. This concludes the video 1 assessment video 1. Thank you very much, Crystal. Yeah.